Hello and good morning to each and every one of you. Today I will be discussing about poison. So what is poison? Poison is any substance that can cause harm or death when it enters the body. Poison can come in many forms including chemicals, plants, and animals, and can cause a variety of harmful effects depending on the type and amount of poison as well as the route of exposure. Poisons can be classified as based on their effects on the body. For example, some poisons may act as irritants and can cause inflammation, while others may affect the nervous system and can cause convulsions, paralysis, or other neurological symptoms. Some poisons can damage specific organs or systems, such as the liver or kidneys, while others may affect the entire body and cause systematic symptoms like fever, chills, or shock. Poisons can enter the body through various routes, including inhalation, ingestion, or absorption through the skin or mucous membranes. The severity of the poisoning may depend on the dose, duration of exposure, and the individual's age, health status, and other factors. Let us now proceed to the types of poisons on the different types of poisons. First, let us start to the number one, organic poisons. Organic poisons are substances that are derived from living organisms such as plants, animals, and bacteria. They can be found in various forms including solids, liquids, and gases, and they can be toxic to humans and other animals. Examples of organic poisons include: first, plant toxins. Many plants produce toxins as a defense mechanism against predators. Examples include the toxin ricin from castor beans and cyanogenic glycosides from cassava and other plants. Second, animal toxins. Venomous animals like snakes, spiders, and scorpions produce toxins that can be poisonous to humans. Marine animals like jellyfish, cone snails, and blue-ringed octopuses can produce toxic substances. Bacterial toxins. Some bacteria produce toxins that can cause illness or death in humans. Examples include botulinum toxin produced by Clostridium botulinum and Shiga toxin produced by E. coli bacteria. Fungal toxins. Fourth, let's proceed to fungal toxins. Some fungi produce toxins that can be harmful to humans if ingested. Examples include aflatoxins, which can contaminate crops like peanuts and corn, and ergot alkaloids, which can contaminate grains like rye. Next type of poison is inorganic poisons. Inorganic poisons are substances that are not derived from living organisms but rather from non-living matter such as minerals, metals, and chemicals. Inorganic poisons can be toxic to humans and other animals and can be found in various forms including solids, liquids, and gases. Examples of inorganic poisons include: first, heavy metals. Metals like lead, mercury, arsenic, and cad- cadmium can be toxic to humans if ingested, inhaled, or absorbed through the skin. Heavy metal poisoning can cause a range of symptoms including abdominal pain, nausea, vomiting, tremors, seizures, and damage to the nervous system. Second, chemicals. Various chemicals can be toxic to humans if ingested, inhaled, or absorbed through the skin. Examples include pesticides, herbicides, and industrial chemicals like benzene, and formaldehyde. Third, gases. Certain gases like carbon monoxide and hydrogen cyanide can be toxic to humans if inhaled. Carbon monoxide poisoning can cause symptoms like headache, dizziness, confusion, and even death. Last, minerals. Certain minerals like asbestos and silica can be toxic if inhaled. Exposure to asbestos can cause a range of respiratory illnesses, including mesothelioma, while exposure to silica can cause lung damage. Lastly, let's proceed to biological poisons. Biological poisons are toxins produced by living organisms that can be harmful to humans and other animals. These toxins can be produced by various types of organisms including bacteria, fungi, plants, and animals, and can be found in various forms including solids, liquids, and gases. Examples of biological poisons include: first, bacterial toxins. Some bacteria produce toxins that can cause severe illness or death in humans. Examples include botulinum toxin produced by Clostridium botulinum and tetanus toxin produced by Clostridium tetani. Second, fungal toxins. Some fungi produce toxins that can be harmful to humans if ingested. Examples include aflatoxins, which can contaminate crops like peanuts and corn, and ergot alkaloids, which can contaminate grains like rye. Third, plant toxins. Many plants produce toxins as a defense mechanism against predators. Examples include the toxin ricin from castor beans and cyanogenic glycosides from cassava and other plants. Fourth, animal toxins. Venomous animals like snakes, spiders, and scorpions produce toxins that can be poisonous to humans. Marine animals like jellyfish, cone snails, and blue-ring octopuses can also produce toxic substances. Next, let us now discuss on the causes or sources of poison. First, household chemicals. Common household chemicals like cleaning agents, pesticides, and fertilizers can contain toxic substances that can be harmful if ingested, inhaled, or absorbed through the skin. Plants. Second, plants. Certain plants contain toxins that can be poisonous if ingested. Examples include poison ivy, poison oak, and poison sumac. Third, animals. Venomous animals like snakes, spiders, scorpions, and jellyfish can inject toxins that can cause serious harm or even death. Fourth, food and drink. Consuming contaminated food or drink can lead to poisoning. This can happen due to bacteria, viruses, or toxic substances like pesticides or heavy metals. Fifth, medications. Taking too much of a medication or mixing medications that should not be taken together can result in poisoning. 6. Carbon monoxide. Carbon monoxide is a colorless, odorless gas that can be produced by appliances like gas stoves, heaters, and furnaces. Exposure to high levels of carbon monoxide can be deadly. 7. Lead. Lead is a toxic metal that can be found in old pipes and other sources. Exposure to lead can cause serious health problems, especially in children. Lastly, 8. Illegal drugs. Illegal drugs like heroin, cocaine, and methamphetamine can be toxic and potentially lethal, especially when taken in large amounts or mixed with other drugs. Let us now discuss on the causes or Entry of poison. Poison can enter the human body in several ways, including: first, ingestion. Poison can be ingested by swallowing contaminated food, drink, or medication. Second, inhalation. Poison can be inhaled by breathing in toxic gases, fumes, or smoke. Third, injection. Poison can be injected into the body through insect bites or stings, needle sharing among the drug users, or accidental needle sticks. Fourth, absorption. Poison can be absorbed through the skin or mucous membranes by coming into contact with toxic substances like chemicals or plants. Once the poison enters the body, it can travel through the bloodstream and affect various organs and systems depending on the type and amount of poison. The symptoms of poisoning can vary widely depending on the poison involved, the dose and route of exposure, and the individual's age, health status, and other factors. Common symptoms of poisoning can include nausea, vomiting, diarrhea, abdominal pain, headache, dizziness, confusion, seizures, respiratory distress, or cardiac arrest. If you suspect that you or someone else has been exposed to poison, seek immediate medical attention. Early treatment can help prevent serious complications and save lives. Let us now discuss on the signs and symptoms on the types of poison on the human body. Number 1. Organic poison. The symptoms of organic poisoning can vary depending on the type of poison and the severity of exposure. Here are some general symptoms that can occur with different types of organic poisons. First, plant toxins can include nausea, vomiting, diarrhea, abdominal pain, dizziness, weakness, tremors, seizures, and even death. Second, animal toxins. Venomous animal bites or stings can cause symptoms like pain, swelling, redness, and itching at the site of the bite or sting. Other symptoms can include nausea, vomiting, dizziness, weakness, difficulty breathing, muscle cramps, and even death. Third, bacterial toxins. Symptoms of bacterial toxin poisoning can include fever, chills, nausea, vomiting, diarrhea, abdominal pain, and dehydration. Some bacterial toxins like botulinum toxin can cause severe paralysis and respiratory distress. Fourth, fungal toxins. Symptoms of fungal toxin poisoning can include nausea, vomiting, diarrhea, abdominal pain, liver damage, kidney damage, and even death. Some fungal toxins like aflatoxins can cause liver cancer. Next is inorganic poisons. First is in heavy metals. They can include abdominal pain, nausea, vomiting, diarrhea, headache, weakness, tremors, seizures, memory loss, and damage to the nervous system. Some heavy metals like lead and mercury can cause developmental and behavioral problems in children. Second, chemicals. Symptoms of chemical poisoning can vary depending on the type of chemical and route of exposure. Some chemicals can cause symptoms like nausea, vomiting, diarrhea, headache, dizziness, confusion, seizures, and respiratory distress. Long-term exposure to certain chemicals like benzene and formaldehyde can increase the risk of cancer. Third, gases. Symptoms of gas poisoning can include headache, dizziness, nausea, vomiting, weakness, confusion, seizures, and respiratory distress. Carbon monoxide poisoning can cause symptoms of like headache, dizziness, confusion, and even death. Lastly, minerals. Symptoms of mineral poisoning can depend on the type of mineral and the route of exposure. Inhaling mineral dust like asbestos and silica can cause respiratory symptoms like coughing, shortness of breath, and chest pain. Long-term exposure to asbestos can cause mesothelioma, a type of cancer. Lastly, let us now proceed to biological poisons. First is bacterial toxins. Symptoms of bacterial toxin poisoning can include fever, chills, nausea, vomiting, diarrhea, abdominal pain, and dehydration. Some bacterial toxins like botulinum toxin can cause severe paralysis and respiratory distress. Second, fungal toxins. Symptoms of fungal toxin poisoning can include nausea, vomiting, diarrhea, abdominal pain, liver damage, kidney damage, and even death. Some fungal toxins like aflatoxins can cause liver cancer. Third, plant toxins. Symptoms of plant toxin poisoning can include nausea, vomiting, diarrhea, abdominal pain, dizziness, weakness, tremors, seizures, and even death. Some plant toxins like ricin can cause severe respiratory distress and lung damage. Fourth, animal toxins. Venomous animal bites or stings can cause symptoms like pain, swelling, redness, and itching at the site of the bite or sting. Other symptoms can include nausea, vomiting, dizziness, weakness, difficulty breathing, muscle cramps, and even death. Let us now proceed to discuss on the treatment or cure on the types of poison. First is organic poison. First, in plant toxins, treatment for plant toxin poisoning can include inducing vomiting, administering activated charcoal to absorb the toxin, and providing supportive care like fluid replacement and oxygen therapy. In severe cases, medical interventions like dialysis and respiratory support may be necessary. Second, animal toxins. Treatment for animal toxin poisoning can include washing the wound with soap and water, administering antivenom, and providing supportive care like pain relief and fluid replacement. In severe cases, medical interventions like respiratory support may be necessary. Third, bacterial toxins. Treatment for bacterial toxin poisoning can include administering antibiotics, providing supportive care like fluid replacement and oxygen therapy, and using antitoxins in some cases. In severe cases, medical interventions like dialysis and respiratory support may be necessary. Fourth, fungal toxins. Treatment for fungal toxin poisoning can include administering antifungal medications, providing supportive care like fluid replacement and oxygen therapy, and in some cases, using liver protectants or other treatments to reduce the effects of the toxin. Let us now proceed on the inorganic poisons. First, on heavy metals. Treatment for heavy metal poisoning can include chelation therapy, which uses medication to bind with the metal and help remove it from the body. Other treatments may include administering antidotes, providing supportive care like fluid replacement and oxygen therapy, and using medications to reduce symptoms like seizures and pain. Second, chemicals. Treatment for chemical poisoning can vary widely depending on the type of chemical and the severity of exposure. Some chemicals may require supportive care like fluid replacement and oxygen therapy, while others may require specific antidotes or treatments to reduce symptoms like seizures and respiratory distress. In severe cases, medical interventions like dialysis and respiratory support may be necessary. Third, gases. The treatment for gas poisoning can include administering oxygen, using medications to open airways, and providing supportive care like fluid replacement. In severe cases, medical interventions like mechanical ventilation may be necessary. Lastly, on minerals, treatment for mineral poisoning can depend on the type of mineral and the route of exposure. Inhaling mineral dust like asbestos and silica can cause respiratory symptoms like coughing, shortness of breath, and chest pain. Treatment may involve administering oxygen, using medications to open airways, and providing supportive care like fluid replacement. Lastly, let us now proceed to biological poisons. On bacterial toxins, treatment for bacterial toxin poisoning can include administering antibiotics to kill the bacteria, using antitoxins to neutralize the toxins produced by the bacteria, providing supportive care like fluid replacement and oxygen therapy, and in severe cases, using medical interventions like dialysis and respiratory support. Second, fungal toxins. Treatment for fungal toxin poisoning can include administering antifungal medications, providing supportive care like fluid replacement and oxygen therapy, and in some cases, using liver protectants or other treatments to reduce the effects of the toxin. Third, plant toxins. Treatment for plant toxin poisoning can include vomiting, administering activated charcoal to absorb the toxin, and providing supportive care like fluid replacement and oxygen therapy. In severe cases, medical interventions like dialysis and respiratory support may be necessary. Lastly, on animal toxins, treatment for animal toxin poisoning can include administering antivenom to neutralize the venom, providing supportive care like pain relief and fluid replacement, and in severe cases, using medical interventions like respiratory support. Next on what we'll be discussing is on the different types of common antidotes. First and foremost, what is an antidote? An antidote is a substance or treatment that can counteract or neutralize the effects of poison or toxin in the body. Antidotes work by binding to the poison or toxin and either preventing it from causing harm or helping to eliminate it from the body. The specific antidotes will depend on the type of poison or toxin involved. For example, these are the common antidotes. First, let us now discuss on naloxone. Naloxone is used to reverse the effects of opioid overdose by binding opioid receptors in the brain. Naloxone, also known as Narcan, is a medication used as an antidote for opioid overdose. It works by blocking the effects of opioids in the brain, reversing the effect, reversing the respiratory depression and other dangerous symptoms that can occur during the opioid overdose. Naloxone is typically administered by injection or nasal spray, and it can quickly and effectively reverse the effects of an opioid overdose. It is commonly used by emergency medical services, healthcare providers, and others who are likely to encounter individuals who have overdosed on opioids. Next is atropine. So what is atropine? Atropine is used to treat organophosphate poisoning by blocking the action of acetylcholine, a chemical in the body that is affected by these types of poisons. It is a medication that is used for a variety of medical purposes, including as an antidote for certain types of poisoning. Atropine works by blocking action of acetylcholine, a chemical in the body that regulates many bodily functions. In cases of organophosphate poisoning, which can be caused by exposure to certain pesticides or nerve agents, atropine can be used as an antidote. Organophosphates work by inhibiting the activity of an enzyme called acetylcholinesterase, which breaks down the acetylcholine in the body. This leads to an accumulation of acetylcholine, causing a range of symptoms including muscle weakness, respiratory distress, and seizures. Third on what we'll be discussing is on antivenom. So, antivenom is used to treat snake or spider bites by neutralizing the venom in the body. Antivenom, also known as antivenin, is a biological product made from animal serum that is used to treat venomous snake or spider bites. The serum contains antibodies that are produced in response to exposure to the venom, and these antibodies can neutralize the toxins in the venom and prevent further damage to the body. When an individual is bitten by a venomous snake or spider, a small amount of venom is injected into the body. The venom can cause a range of symptoms depending on the type of snake or spider involved and the amount of venom injected. These symptoms can include pain, swelling, tissue damage, and even systematic effects such as nausea, vomiting, and difficulty breathing. Antivenom is typically administered by injection, and it works by binding to the venom toxins and neutralizing their effects. Antivenom is most effective when administered as soon as possible after a bite occurs, and it can be a life-saving intervention for individuals who have been bitten by venomous snakes or spiders. It is important to note that antivenom is not available for all types of venomous snakes and spiders, and its use can be associated with certain risks and side effects. Last on that, what we'll be discussing is the calcium EDTA. It is used to treat lead poisoning by binding with the lead and helping to eliminate it from the body. Calcium disodium EDTA, commonly known as calcium EDTA, is a chelating agent that is used to treat heavy metal poisoning. It works by binding to heavy metals in the body such as lead, mercury, and cadmium, and forming a complex that can be excreted through the kidneys. Heavy metal poisoning can occur as a result of exposure to environmental toxins, such as lead in paint or mercury in seafood. Symptoms of heavy metal poisoning can vary depending on the type of metal involved, but they can include abdominal pain, nausea, vomiting, headaches, fatigue, and neurological symptoms. Calcium EDTA is administered by injection, and treatment typically involves multiple doses over a period of several days. In addition to chelation therapy, other interventions may be needed to manage the symptoms of heavy metal poisoning, such as supportive care, monitoring of organ function, and treatment for complications that may arise. It is important to note that calcium EDTA should only be administered under the supervision of a healthcare provider, as it can have certain risks and side effects. In addition, chelation therapy is not appropriate for all types of heavy metal poisoning, and the appropriate treatment for specific case of poisoning will depend on the type and severity of the poisoning as well as other individual factors. To conclude my report, poisons are substances that can cause harm or death when ingested, inhaled, or absorbed by the body. They can be found in various forms, including liquids, gases, solids, and even plants and animals. While some poisons are naturally occurring, others are synthetic and are created for specific purposes such as pesticides, medicines, and industrial chemicals. The effects of poisons on the body can vary widely depending on the type of and amount of the substance ingested, as well as the person's age, health status, and other factors. Some poisons can cause immediate and severe symptoms, such as respiratory distress, seizures, or cardiac arrest, while others may have more subtle effects over time, such as chronic illnesses or cancer. Preventing exposure to poisons is critical for maintaining overall health and safety. This can involve taking precautions when handling hazardous chemicals, storing and disposing of substances properly, and avoiding potentially poisonous plants and animals. In cases of suspected poisoning, it is important to seek immediate medical attention and follow proper procedures for identifying and treating the poison. Overall, while poisons can be dangerous and potentially deadly, awareness and prevention can help reduce the risk of exposure and minimize the harm they can cause. Poisoning can be a serious medical emergency and may require immediate medical attention. Treatment for poisoning may include administering antidotes, providing supportive care such as oxygen therapy, fluid replacement, or pain relief, and in some cases, performing emergency procedures such as gastric lavage or hemodialysis to remove the poison from the body. That is all for my reporting about poison and its types of poison and the common types of antidotes, the signs and symptoms of poison, and what are the sources of poison. Thank you for listening and have a great day ahead.